Hi, good evening. I'm Dr. Philip McMillan. Thank you for joining me. I've been following the COVID story since early 2020. My focus has always been around autoimmunity, and so I look at it through a different paradigm. So, whenever I speak, rarely am I going to be following the narrative. So, if you expect a narrative, this is not the place to come. So, before I start, I'll be looking at this very unusual case of a patient who took over 200 vaccines. This is the paper in the Lancet. And I'll be tying this critically to why it is that I think that the boosted keep on getting reinfected. And I'll be using the understanding about IgA antibodies to try and make sense of what is going on. So, before I start, I'd just like to remind everyone that if you are interested in courses and more information, please look at the links below. And that's where we try and share as much as we can about what we see from a different angle. So, join us on this journey, research journey. Be open, be interested, and I'm sure you'll find valuable information. So, let's get back to this case here. This gentleman in Germany took 217 COVID vaccines. And what's interesting about this is this has been almost a promotion that, goodness, safe and effective. And I'm thinking, this is like the worst example you could ever use. So it just doesn't make any sense. So this is Gavi that was talking about this hypervaccinated gentleman, and they were focused on what happens when you receive hundreds of doses of the same vaccine. And as I said, quite a number of people are saying, wow, this just shows how safe it is. But I'm thinking, we don't know. What are the longer term implications? Please don't imagine that this is ever a good thing. But they did indicate from the paper, current research indicates that a three-dose vaccination coupled with regular top-up vaccines for the vulnerable groups remains the favored approach. There is no indication that more vaccines are required. So that's what they have said from the paper, from the people who had done the paper. But as I said, as long as you're not following a narrative and you actually are trying to understand the science, you know where to unpick the data. This is why I've said, don't tell me what I need to know. Just give me the data. Let me interpret it and try and make sense of it. And so this is what I'll be quickly doing here so that you can understand. So again, let's go back to the paper. And in this case, what they had was a gentleman in Germany who, for whatever reason, he probably was extremely scared from the information going out about the pandemic. He was 62 years old. He deliberately and for private reasons received 217 vaccines against SARS-CoV-2 within a period of 29 months. That's incredible. I mean, for one, I don't even know how it was possible that he got that many without people noticing. When you have, and you can't even get some kind of normal therapeutic from the pharmacy because you would need a prescription. It just shows you how far the system was pushing this, where there was no concern about people who took too much. I guarantee you he won't be the only one. There'll be many of them out there. What are the implications? What does it mean long term? We have no idea. And just thinking that it should kill somebody within a few months or a few years of taking it doesn't make any sense. That's not how disease works. But let's get back to what I think is very important here. As I said, I unpicked the data. And so, in order to understand what I've been unpicking, you have to look at the supplementary data. So, this is the supplementary data from the paper. This is the Lancet. And you can see here, they then add additional information for people to be able to make sense of it. So, that's the bit that I was interested in, the supplementary appendix. And it then rolls down, it gives you limitations, supplementary methods, and so on. And it gives you a bit more information about the individual as well as what they were studying and how they were sampling it. So, this document is oftentimes very, very important, and it's a critical part of understanding what is going on. So, why is it that I have got here in this blue section? This is likely to be the explanation as to why the boosted keep getting infected. Why would I say that? It's because one of the really simple questions is that if you understand how the immune system works, the first wall that any virus or bacteria or fungus has to get through is the mucosal layer. It is very sophisticated. It's not just random. It's only when it penetrates that mucosal layer that you can then get infection. So, this is how the immune system works. This is an example of how you have here, this is the mucosal barrier, these are the cells, and they are producing mucus on top of it to try and block. It's a physical barrier to prevent bacteria. These here in brown are bacteria from getting in to be able to get through this wall. This wall is very important. And on this side here, I've put a few viruses here. This is a virus, these are bacteria. And what you have to notice here, this blue thing that looks like a bone represents secretory IgA. And this is what the immune system produces in the mucosal barrier because it defends the body even before the microbe gets in, or the virus. And you can see here, this is a very sophisticated system. It gets the antigens. This T cell is then stimulated. It differentiates into more T cells. These T cells then stimulate the B cells. The B cells then become plasma secreting B cells to produce IgA. They then move along and then they produce the IgA. The IgA is then pushed out into the mucus. And this is how the body will fight infection right at the front. These are your pawns almost right at the front line if you play chess. So these are your foot soldiers when you look at old movies. They are the ones going first to defend the castle. Really important part of the immune system. And what it will do is in this picture here, it will then bind to the virus in terms of SARS-CoV-2. This is the virus here. This represents the IgA coming in, binds to it. It then prevents the virus from entering. It then gets picked up by other immune cells, or it gets flushed out with the mucus. You blow your nose or whatever, and you get rid of virus. So this is an integral part of the mucosal immune system. So my question was always, why are we seeing the boosted continually getting infected? Well, because they were so busy looking at the benefits of overboosting somebody with 217 vaccines, they did an important piece of data. They looked at the control group. That's a group of people who had 3 vaccines, and they were comparing it to the person who had 217. What were the differences? So this is now where it comes down to the data. I've taken this from the supplementary data, and if you are interested, you can look at it. But here is what it's showing. So in black here represents the antibody level in the control group, probably the average. And you can see here that they had between 10 to the 1 and 10 to the 2 times an anti-spike IgM in serum. Okay, that's in the bloodstream. You can see here that his IgM after 217 doses was just a little bit higher. But IgM is the early antibody, so maybe that makes sense. When you then go on, now this is the anti-spike IgA. So some of the IgA that is produced in the mucosal lining also gets in the serum. And you can see here, really interestingly, the control group didn't have any, not detected. He had some, again, between 10 to the 1 and 10 to the 2. Now, this is the bit that I'd always predicted that was very interesting to me. Now, look at this here. This is spike-specific antibodies in saliva, okay? Saliva and technically, therefore, mucosa in the mucus, in the mucosal lining. For the control group, none detected for IgG. But for the person who had taken 217, or at the time 215, his levels were significantly higher, between 1.2 to 1.4. And this is probably why he didn't get COVID infection, because this remained high in his saliva for such a long period of time. But as I said, the answer that's really important is this. In the control group who had 3 doses, they had no IgG in their saliva, no IgM, he didn't have it either, and no IgA. So, what it indicates here is that for this person with the high IgG in the saliva, it means therefore that once his serum antibody level falls, he will have no antibodies in the saliva and most likely, therefore, in the mucosa. It is no wonder then that we see these repeated infections. The immune system is no longer functioning as normal. This is what I'm saying. So think about this. Just look at this here and get your head around this. They're no longer producing IgA. All that's happening is the mucus. They're unable to fight at the front. They have no soldiers there on the ground. No wonder the virus is able to penetrate. And this then causes recurrent infection. Listen, as I said, for those who are following a narrative, you'll take a look at that and say he didn't die from 217 vaccines. That's great. For those who are interested in the science, this is very significant. It has highlighted some really important points that we need to reflect on. How then do we protect the vaccinated cohort who have been boosted, who are not having an adequate mucosal response to the virus, especially Omicron as it continues to spread? What do we do down the line? Is it that they're suddenly going to start producing these antibodies? We don't know. But I think that ignoring these patterns or not even reflecting on them, only focusing on what appears to be a narrative is very dangerous. We are in very serious times. The virus continues to circulate. What are we going to do? It's a risk to everybody around in highly vaccinated regions. So, again, as I said, if you're interested in more information that doesn't follow a narrative, please click on the links below. There's a lot more that we have to cover in this period of time. So, have a great evening, and I look forward to sharing some more information with you in the near future. Thank you.